You are also very welcome to our A Touch of Pink summer lunch. It is exciting to have everyone together after such a long time apart. These past 2 years have been challenging, not least because we were not in a position to bring you all together for our usual physical events like Battle of the Stars, our annual lunch, our golf classic and indeed our Great Pink Run events, and that was hard. It was difficult not being able to meet up in person and applaud all your efforts in supporting us throughout the year. That said, the past 2 years have been a resounding success for Breast Cancer Ireland. Last year alone we raised over €4 million, up from 2.2 pre-COVID times. We learned quickly how to adapt our business model. We transformed how we worked by upskilling, enhancing and engaging across our digital platforms. We researched what you, our community, wanted from us, and together with our new digital team, Wolfgang, we began to streamline our communications in relation to our research, education and awareness and our fundraising efforts. We also partnered with the dynamic duo of Niall Carroll and his wife Cara from Louth and their 100k in 30 days initiative, which has been hugely successful and has raised close on €3 million to date. They are once again in the midst of this campaign as I speak, getting thousands of people from all over Ireland and overseas to participate in some way during the month of June. Their support has led to Breast Cancer Ireland being in a position to develop a new clinical trial that will change the face of treatment into the future. This new trial, the Shamrock trial, will focus on HER2 positive breast cancer subtype and will recruit patients from across Ireland. 30% of HER2 positive patients may experience a recurrence in time, and this trial will see the introduction of a new fourth generation drug being administered alongside initial chemotherapy, and then after 1 month, de-escalating chemotherapy completely. The team believe that in 3 years' time, all patients with a HER2 positive diagnosis will have a 100% response rate, a cure for this particular form of breast cancer. The poignancy of this trial is that it will take place in the new Breast Cancer Centre on the grounds of Beaumont Hospital. This new €6 million centre was officially opened on Friday the 3rd of June last by First Lady Sabina Higgins. Breast Cancer Ireland is so privileged to be a significant donor to the centre as a result of your help and the help of so many over the years. The new facility will be a one-stop location for over 10,000 women and indeed men annually. It has 5 imaging suites with the latest imaging and ultrasound equipment, as well as 8 examination and consultation rooms, and the very latest clinical trial unit on the top floor. We say that this centre will offer bench-to-bedside care for patients into the future, where the latest developments in clinical trial will become part of the personalised treatment plans for those diagnosed. We continue to invest heavily in our research collaborations both nationally and internationally. In Ireland, we are supporting research into triple-negative breast cancer with a team at Queen's University Belfast, who are seeking to discover newer therapies for those diagnosed. This subgroup is very challenging as it tends to affect younger women, and not a lot of research has been done to date. Their treatment plans to date include the age-old regime of surgery, chemotherapy and radiation therapy, which can in turn plunge patients into early menopause, thereby affecting fertility. The team in Belfast are looking for new drug therapies to avoid chemotherapy and therefore help manage this disease more effectively with less toxic side effects. In Ireland, we continue to work tirelessly in support of research being undertaken into metastatic disease progression. This is the most challenging aspect. This is when, after initial breast cancer treatment, the patient has a recurrence, yet the cancer has spread to other major organs of the body: lung, liver, bones, spine, and often sadly to the brain. We have newly discovered clinical trial drugs that are helping for certain major organs, but the progression to the brain is one that scientists are seeking desperately to find a way to block that progression. Together with the world-famous Ludwig Breast Centre at the University of Chicago and our supported research centre in Ireland, teams are seeking to identify the pathways where cancer cells are evading initial treatment and in an attempt to build better barriers that will prevent progression to the brain. Sadly, in the last 12 months, and indeed during the COVID pandemic, we lost some very dear friends where their disease had unfortunately metastasised to the brain. Our close friend and Breast Cancer Ireland Ambassador and Education Coordinator, Orla Byrne, passed away in November. And Orla was a real champion of research, having been so many years on a new clinical trial drug, helping to support her bones, spine and lungs. She ran many a Great Pink Run with her family and friends while going through treatment and while in remission. She was the epitome of strength, that inner strength that one has to dig so deep to draw on, and that she did every day until the end. She and Edel Cannon and Fiona Lambert are very sadly missed from our Breast Cancer Ireland family. We continue to support our designated breast cancer research nurses across the 8 designated cancer centres, whose role is to collect and collate tissue and serum samples from patients, building a national biobank from which clinicians and scientists nationally can now avail, ultimately accelerating research discovery into clinical trial and onto the development of newer, more effective drug therapies. Research publications from this biobank have increased significantly since it began, with centres previously producing 1 peer-reviewed paper in 18 to 24 months. Now they are producing on average 8 to 9 papers per year. Our amazing education and outreach team, who are with us here today, have been doing stellar work both during COVID in an online virtual capacity, and now that things are opening up in a physical way, visiting schools, companies and community groups across Ireland. During COVID lockdown, they had met virtually with over 20,000 women and young girls, raising awareness on the importance of understanding good breast health, knowing the signs and symptoms, and more importantly, how to perform a self-breast examination properly. These sessions, thanks to the sponsorship from the likes of Core Market Financial Services Group, the INTO and indeed UPMC Hillman Cancer Centre, have resulted in some very early detected cases as a result. So a big thank you to them and to all for making a difference. A massive thank you to you and so many who support Breast Cancer Ireland on an ongoing basis. Your support helps to accelerate and realise our vision of transforming this disease into a long-term treatable illness.